Hi, I'm Dr. Grace, an endocrinology fellow, and previously at our last video, we had talked about prediabetes and how you can check your blood sugar to know if you have prediabetes or not. Check out on our video to learn more about this. Today, we're going to be more practical actually. So we're going to be talking about how you can check your blood sugar at home, at the comfort of your home. So the device used to check your blood sugar are in different forms. There is one type that is for self-test, like you check yourself on timely basis, and that is a glucometer. And one of the devices here that I'm going to talk about. And there is another one that is called continuous glucose monitoring. This monitors your blood sugar continuously, even when you're sleeping. It monitors it and it beeps. So we have the Freestyle Libre and Dexcom. The Dexcom are in different numbers, 6 and 7, and we have Freestyle 2, Freestyle 3 Libre as well. We're going to talk more about the continuous glucose monitoring later. But today, our goal is to talk about the glucometer. There are different products out there, but they are all the same glucometer and the same way it is used. So today, I'm going to talk about the product I bought from CVS, and I'm going to show you how to check your blood sugar, and we take it from there. So let's do this. So the first thing you need to do is to wash your hand. Wash your hand with warm water and with soap to keep the ends of your finger, the soft part of your fingers, very warm and soft and easy for blood flow. And then what you need aside the device is your alcohol, and I have the cotton round there to use to clean the tip of my finger. All right, so what do we have here? Let's see. Okay, I have opened it previously so that I can make sure I have everything I needed. So this is just the pack where you keep your device, and then this is the manual. I don't need the manual now, and so do you, as I'm explaining everything already. And then same guide again on how to use it and how to apply it. I need the logbook actually. So this is very, very important. This is called self-test logbook. You need this when you come to the clinic to see your doctor, your primary care doctor or your endocrinologist. The reason being that in the logbook, you should be able to write your blood sugar. Let's say, for instance, this is in the morning, you haven't eaten. Before your breakfast, you record your blood sugar reading. And before lunch and before dinner. So it comes up in columns. You document for each day and you go like that. So this is very important when you're checking your sugar. So you should have it at your side like this. Now, what else we have here? So here we have the Lancet device. This is what you need to check, to prick yourself of the blood sugar. And it comes in different numbers. The numbers shows how deep you're going to go into your skin when you prick your need yourself. For most people who have very soft skin, it's good to use level 1 and level 2. Level 3 if you intermediate, and level 5 if you have a very thick skin. You've been pricking yourself more too often and your skins are getting dead, and so you want to use the level 5. And then you see the arrow. I'm going to talk more about this and how we will put in the Lancet. So this is the Lancet device. I put it here on the table, and we need our glucometer. Yep, the glucometer is so small, but it's very good. In real life, you can see it. It looks so small, but in the camera, I'm going to zoom it out so you can see how big it could be. Okay, so here, right now, as you can see, there's nothing in the screen. The screen is there, but if I put in a test strip, it automatically comes on. And this is the part where you put your test strip. All right, so we have our glucometer. It comes in different shapes and formed by different products. You need your Lancet device and then your test strip. Okay, so for your test strip, make sure that it's the same true matrix it says, and here is true matrix. So make sure it says the same thing for you, so you don't buy the different Lancet, a different test strip for different device. And then second thing you want to know is the expiration date. So this is going to expire in 2024. So I'm still good to go. All right. So they say if you open it, from the first day you open it, you need to use it for 3 months. So for you to have accurate results. So on the test strip, we have two different ends. One of the end has multiple straps, and the other end has just one single strap at the middle. The one single strap at the middle is where your blood goes into. The one single strap, and the multiple one is where your you put to the glucometer. So now we have everything. The next is to prepare yourself. So before you prepare yourself, it depends on which way you go. Sometimes some people prepare themselves first. I've washed my hand. Some first prepare the device and then you prepare yourself. So let's do it by first preparing the device. It makes it easy. Okay, so you take your lancet device, this little thing here, and then I should have needle. Okay, then this is the lancet itself. It comes in multiple, I have up to like 50 here in the pack. So this blue thing is called lancet, and this is the lancet device. Now, your goal is to put the lancet in the lancet device. So the lancet device prick you, and you're not directly pricking yourself with the needle. Now, here's the catch. If peradventure you lost your lancet device, you can still use your lancet needle itself. The only thing is, if you're not afraid of looking at needle, then you can go ahead, because this is the lancet and you can directly also use it on your skin. But to make it easy for you to check your sugar without looking at the needle, it's good to use the lancet device. All right, so the lancet device has an arrow. At the arrow there, you hold the lancet at the side and just turn to, you twist it to open it up. Right, the time you twist it to open it up, it comes up this way. And then you pull your lancet in it. So the lancet device has a break in between. Where that break is, see that little or break line, that's where I plug in the device. And you just push it in. And when it does that, it pushes this back. So don't push it forward. If you press this thing, it pushes it forward. It's already like triggered. You don't want to trigger it till you use it. So then you untwist the lancet itself so that the needle can be exposed. And you have the needle exposed. Here you go. You can see the needle. It's very tiny, small needle. So you cover up back, you pull your lancet, other part of the lancet in, and you twist it back in, and it's there. Now this is ready for use. Use one needle per prick to avoid infection and to also avoid more pain, because it becomes more painful when you have used the needle and you're reusing it again. So this is ready. Now the next is to take your glucometer, and remember what I said, the part with the multiple lines goes into the glucometer. So you slide it in the glucometer. And the moment you do so, watch out, the glucometer light up. And wait till you get that little blink of like a blood at the center. You see, yeah. So now it's ready to read. So now we're ready. All you need to just do is clean up yourself. This is my alcohol. You're going to use the side of your finger because they are less sensitive for pain, and you can easily get more blood flow from there as well. So you wipe your finger. Good. You should let it dry a bit. So I'll put this here. It's a little dry. Now it's dry. Now you put your lancet device to your finger where you want to prick. When you put it close tightly together, then you press this down, the lancet device trigger. You pull it down and then you get the blood. Yeah, that's painful. Number 3 is painful. I see blood. Okay, if you don't like seeing blood, you can skip for like 30 seconds. So here is it. With the blood, you wipe it off, the first blood, so you don't get all the dirty things on top of your blood into the reading. And then you gently squeeze. If nothing is still coming, just gently squeeze it and it comes up. Don't squeeze too hard so you don't give wrong reading. All right. And now you push it in. Ooh, here we go. It's reading. It's reading. It's reading. Let's see what we got. 94. Yay! This is good. Okay. So this is a good blood sugar reading. All right. You wipe yourself. After you've gotten your reading, good. So you wipe yourself dry. The reading says 94. So do not forget to record it down. And that's it. That is recorded. Now, you want to make sure you dispose all the things you have used carefully and neatly. So most importantly, the needle, because it is sharp, I plug it back to the lid, the cover of it, so it makes it blunt, and that way you can easily dispose it. You untwist this, and then you get your needle back. Do not just pull it out like that because you don't want to prick yourself again. You plug it back to the needle device, the lancet cover, and now you can easily pluck it out. Now you can dispose it. Then you cover this and you close it back. Now this go back. You can then keep all this in your bag, the little purse that they give you. Now the test strip, you have to remove that as well. So I remove it like this. And then the moment you remove it, it goes back off. You see? And that saves the memory in the battery. Your test strip, you put it back into place. And if you need to give yourself your medication before you eat, then this is the time to do it. So, quick rule. Now you have this, you dispose all that you have used in your sharps and disposable. So I have my sharps and disposable here, so I put it aside and dispose. And then there you go. So quick points. Check your blood sugar before you eat. If you're on insulin, don't give yourself insulin and then check your sugar. That makes your sugar reading inaccurate. Always check your finger stick before you eat. Always check your finger stick before you eat and record it down, and that's it. Depending on what kind of diabetes you have, some check more frequently, more than 3 times in a day. Some check just once a day and sometimes once in a week, depending on what your doctor says. So we see you next Saturday, and we're going to talk about diabetes in detail. We have talked about pre-diabetes, how to check your blood sugar. Now we are going forward to talk about diabetes. Join us and subscribe, and we'll see you next Saturday. Till then, bye.